I certainly believe that this patient population is vastly underserved by the healthcare industry due to the limited resources and high degree of friction. And bringing AI into the equation, I think we can dramatically expand the impact of healthcare workers, leading to improved clinical outcomes and care.
And welcome everyone to Slator Pod. Today on the podcast, another exciting startup company, and we welcome Joe Corkery. So Joe is the CEO and co-founder of Jaide Health, a tech company specializing in real-time AI-driven medical interpreting and translation services. Hi, Joe, and thanks for joining.
Hi, thanks for having me on here. It's a real pleasure to be here.
Yeah, we always like to invite interesting startups, interesting new companies. So I'm really glad to bring Jaide Health to our audience. So where are you recording this from today?
Just outside of Boston, Mass.
All right. So give us the Jaide Health elevator pitch. It's quite early stage, right? You go to the website, still there's a wait list. So give us the elevator pitch to get started here.
At the highest level, what we're building here is basically a healthcare-specific version of Google Translate. We want to make it easy for clinicians to interact with their limited English proficiency patients, and basically instantly, being able to have that conversation with them there, or as well to provide them with written translation of documents that they need to take home.
So tell us a bit more about your background. I think you were with Google, you were a product leader there. So tell us about that. And you're also a trained physician. So quite the combo.
Yeah, I've been working at this intersection of healthcare and technology for the better part of 25 years now. I studied computer science as an undergrad at Princeton, and then headed on to Harvard Medical School to get my MD. And interestingly, I took a 2-year hiatus in the middle of medical school to actually join a computational drug discovery startup. And I was working there as a software engineer for a couple of years, which was a ton of fun. And I really enjoyed that. But I decided I still wanted to, go back and finish the degree, because I thought, I might still want to, practice day to day. And so went back, finished the degree. Ultimately, I decided I really wanted to do healthcare tech a little bit more from the tech side. So I ended up returning to that same company after graduation, stayed there for about another 10 years, which is what led me to Google. I had this really amazing opportunity to come join Google Cloud because they wanted to really build out healthcare products on Google Cloud. And so I joined in 2014. And what I quickly discovered was that no healthcare organization was really willing to move to Google Cloud at that time. So I actually spent the next couple of years really laying the foundations for healthcare customers, building out security, privacy, compliance efforts, really making HIPAA compliance something you thought about first as opposed to at the end. Eventually, I, along with a number of others, convinced the cloud leadership to start a sort of a dedicated new healthcare and life sciences vertical, where I led the product team there. And that's actually where I met my co-founder, Julie Wilner. And we've been working together ever since, almost about 8 years now. That was a really exciting time. We got to launch a number of new products, really focused on healthcare data analytics, healthcare data interoperability, security, and of course, AI, building out sort of healthcare specific natural language processing and healthcare specific speech to text. So did that really until about 2023. And Julie and I left Google and we started Jaide later that year.
Was there a particular trigger for this? I mean, was this probably was pre-ChatGPT and pre just general AI? I mean, just a few months probably before that, right?
It was definitely on the scene, increasingly on the scene around that time. And I think, when we left, that we knew sort of as technically clinicians, Julie's a nurse by background as well. We knew that we were going to build something in healthcare space, and we wanted to build something that was going to have a meaningful impact on patients. And as we were watching everything evolve, we really figured that generative AI was going to figure strongly into what we were doing, just watching that pace of evolution. And, when you talked about sort of like particular moment or challenge, one of the things that we really spent a lot of time thinking about is, back when we were both still at Google, we regularly heard requests from healthcare executives asking for Google to build a healthcare specific version of Google Translate that they could use with their patients. And this concept always resonated with me, partly because I remember enrolling in a medical Spanish class at Mass General Hospital, so I could actually communicate with patients better. Of course, like the limiting factor I had was I only had a foundation in Spanish, and there were a lot of other languages spoken. But for a variety of reasons, this really never gained traction at Google. And so years later, find ourselves on the outside. We decided to see if there's still interest in an offering like this. And the short answer was that, yeah, there was a lot of interest. It was pretty widespread. And I spent a lot of time talking with different CMIOs and CMOs across the industry here, and a lot of them actually highlighted this as a top priority for them, to solve with the technological solution. And what I liked is that they trusted us as technical clinicians to actually build it right.
Yeah.
It wasn't going to be just something we threw together. And so that interest combined with sort of their confidence and the applicability of large language models to this problem and the ability for us to drive a positive impact on care delivery kind of made it an obvious choice for us to invest in.
So I guess you can answer the question: what if Google built this with some authority? Because that's been the eternal question in the language industry for 10 years, right? So what if Google did this? I guess in your case, you're like, well, I was there. They didn't build it. I build it now.
The short answer is Google was really great at building the infrastructure technology behind the scenes in this, and it is and they do a lot of things great on the consumer side, but I think where there's still a lot of opportunity is for startups and other organizations to really build the vertical specific applications on top of what they're building. I think this is really something that I certainly learned during my time at Google and elsewhere, that you really need a lot of deep domain expertise to sell into the healthcare industry, and you're able to hire that, but ultimately it's a different ROI than it is in other areas. And so, it's an area where I feel like they're really excited to build a lot of the great AI technology that kind of can be behind the scene, but, really would rather partner or let others deliver the actual vertically integrated application.
So as a Harvard trained doctor, so let's go a bit to the language element, patient doctor communication. Like, what are the different layers here, levels here, right, in terms of criticality, and what kind of obstacle is the language barrier? You mentioned Spanish, of course, number one language, and other than English in the US, but I mean, there's 100, 200 more that are spoken. So what are some of the key aspects, and again, what kind of obstacle would the language barrier be in patient doctor communication?
Communication is really at the heart of delivering healthcare, and when you're trained as a doctor, you actually spend a lot of time learning how to talk to patients, learning how to do an interview, how to elicit a history from them. So there's a huge emphasis on communication, and a language barrier is very much a barrier. It gets in the way of being able to do that, and historically we've really relied on human interpreters to fill that gap, and they do a great job. But the challenge is there's a lot of friction with getting an interpreter for your encounter. Yeah. They're a special, limited, rare resource, and so getting someone in the room with you at the right time, there are a lot of scheduling challenges for that. There's availability issues, what language you actually need. So it's great when you can have that. But oftentimes you can't, especially when you're seeing something quickly. And this is where I see one of the real great challenges. Like there are lots of situations in healthcare where your encounter is scheduled. So like, yeah, you go in to see the doctor. They know when you're coming. You have a surgery planned. You know when that's going to happen. But there are probably 10 times as many encounters that the healthcare provider has with the patient that are unscheduled. And what ends up happening is that limited patients who don't speak English don't get seen as often. They don't have those encounters because of the friction in getting somebody involved there. I've actually seen folks in this. Actually saw a situation where a nurse had basically asked someone and said, well, actually, can we kind of try to get through this in English because it's so hard to get an interpreter on the line? And I'm like, and the patient clearly, like, they spoke enough English to be able to say yes to that. But I was also like, do they really understand the conversation that's happening? And so I think that's like, but one, and then when you look at like, inpatients, um, you know, the, a huge part of like your care is like talking with your nurses, and those conversations are, um, you know, oftentimes very fast, very, very short, very targeted. But if you don't have those, you can really end up feeling very isolated in the healthcare organization, as a patient. So yeah, I think, ultimately communication is really central. And I think there are really two things at play of like, how do you facilitate the scheduled interactions? And then, how do you facilitate those unscheduled interactions that happen sort of as a one-off? And I think what we're seeing is that patients who don't speak English are getting way fewer of those unscheduled interactions than everybody else does.
Are you working at all with human interpreters, or are they somehow part of the platform? If so, how?
We've spent a lot of time talking with human interpreters, and one of the things I'm excited about is like, sort of as a group, this is like a really passionate group of people who really want to provide, care to a patient. And, but one of the things that I've really seen is that they're very excited to work on those complex human interactions. And so we've actually been, I would say I've been really pleasantly surprised by the reception that we've seen from language services groups within hospitals, because they see us as providing another tool in their toolbox where we can help them expand the reach of that organization so that their human interpreters can really focus on what they love to do, what they excel at, and we can, tackle, a lot of those other interactions where they're not available. And so, we like to think of it as, we're basically providing a tool that allows human interpreters to operate at the top of their license by taking on a lot of the work that, they don't want to do or they don't have the bandwidth to do.
Did the move from, it used to be like neural machine translation, speech to speech was super hard to do at all, if even impossible, given all the latency and all these other problems. So let's say with, ChatGPT, October 2023, Gen AI came on the scene. How do you view this for medical interpreting, let's say, versus maybe any of the technologies before? Did you feel it's only really possible to do what you do now with these technologies, or could something like this have been reasonably done maybe 3-4 years ago, or it's basically only possible now? And maybe like just one other thought, like, these everybody trusts these models a lot more than they used to, right? I mean, 5 years ago, it's like, oh, obviously machine translation is going to make mistakes. Right now,
Yeah.
people are putting all kinds of things into ChatGPT and expect a perfect answer. Like, how do you mitigate the risks that still remain?
Clearly, people were using Google Translate to do this for years. Now, they weren't supposed to, and it wasn't providing the services they need, but it was filling a niche and filling a gap. And so you could say that, a solution like this, built on technology from 3-4 years ago, would have found a place in the market if it had HIPAA compliance and some optimization for the healthcare industry. But I think with generative AI, it really does change the way that, all of this is possible. And, one of the things that I think is really interesting that is that, historically with like neural machine translation, you would see most translations happen on a sentence by sentence basis. And they had no concept of context between the sentences. And when you look at something like, generative AI, you can, taking into context is really important. And so, it allows you to, have like one of the things I think is, interesting is like, if you have differences in gender, you're most likely, you're going to keep that in generative AI versus, it might be kind of random in neural machine translations. Similarly, like understanding that like, oh, I talked about this thing, 3 or 4 sentences ago, it still means the same thing here, I think is really important. I like a good example of this where I think, well, one of the things I'm excited about generative AI is it allows you to provide a lot of context. Because, one thing that we've seen in our work to date is like, particularly generating like translating discharge instructions, is that information is often incomplete in terms of like knowledge about the patient. And so you can see a situation where it's like says, you might see the term SSRI in there. And depending on the context, that could mean like sliding scale regular insulin or a selective serotonin reuptake inhibitor. And those are very different things. And one of the things that's nice about generative AI is you can provide more of that context. So it'll have that. But I think also um, we're just seeing the pace of generative AI, like the pace of improvement is so rapid that, when you think about it, like the idea that, you could actually use AI to do interpretation and translation in real time 3 or 4 years ago didn't, no, it's like, no, that's far, far away. But now you look at it, it's like just the pace it's going. You're like, oh, actually, maybe 2 to 3 years from now, like no one's going to be questioning whether this is the right thing to do or the right approach. It's like, oh, it's there. And, and part of this is really building for the future. And one thing I did want to touch on with that you mentioned earlier is speech to speech. Because that's actually really interesting to me. But I think one of the things that one of the challenges with speech to speech is you miss the ability to have kind of a sanity check in the middle. And so a lot of what we do is like when you speak, we transcribe that, we generate the translation, and also a back translation, and so you can actually see what you've said, how it's been translated, what it thinks that means in real time. So that gives you the ability to correct, and you can see the same thing on the patient side. And I feel like that's a really important sort of safety layer that exists in the middle right now that, like maybe 3 years from now, everybody will be like, no, this gets it right 99% of the time. I don't need to worry about it. But I think I think speech to speech is going to be huge outside of healthcare very early, but I think it's going to take a little bit longer in healthcare because people are going to want to have more of those sanity checks.
We did speak about Google and not going too vertically specific, but Microsoft released something called Dragon Copilot for healthcare, and they made a big kind of PR and marketing campaign around it. So did you look at this? How deep does it go? Like, is it competing in any shape?
It's really interesting. I'm never a big fan of pre-announcements, and we really try to only announce things, when they're ready to go and have been deployed in multiple systems. But it's a really exciting time for AI in healthcare, and Microsoft is very obviously making a big bet there. Looking at, I've had a chance to kind of watch a couple of the videos and read some of the press releases there, and it's actually been hard to figure out a lot of details of its actual capabilities. But one thing I was struck by was they had this comment that says you can now conduct interviews in Spanish without the need for a translator.
That was the one we zoomed in on too. Yeah.
And I'm like, okay, and I'm like, well, what does that mean? And it was really hard to find anything about what does that mean. But what I could glean is that basically, at first glance, it sounds like they're saying Copilot can be your interpreter. But as I look deeper into the video and some of the other details, I think what it's doing, it's not facilitating a multilingual conversation, but instead it's supporting the generation of an English note when both the physician and the patient are speaking Spanish to each other. And this is actually a pretty common scenario in many areas in the US where, there's so many bilingual care providers that they'll just have those interactions there and they're both speaking Spanish. So I don't know. I mean, I'll be curious to see, but I mean, because I think because they talk about because certainly when you watch their video, it's like the interaction mode for this is capture Spanish, and I'm like, didn't say anything about it interacting with you. And I think a lot of the ambient AI technology out there, those are tools that are designed to be in the background. And they're designed to not be present as part of the encounter. And so, and I think that's where I think there's a big difference between what we're doing and what they're doing, in that our goal is here to be in the middle of the encounter as opposed to being in the background. And so I think there's a lot of really exciting work going on. I'm excited by the announcement because I think it represents a growing recognition of the importance AI is going to have in the language services space, especially in healthcare. So that's great. But I also think there's lots of room for multiple players as well.
Yeah, in the past, they did a lot of announcements, they being just big tech, and then it just never quite went deep enough. And so the ecosystem of kind of language tech providers, is very, very lively. We have to talk about President Trump's executive order declaring English the only official language and revoking, the Clinton era language access order. What are your thoughts? We recorded what we called an emergency podcast last week, so let's follow up on that. What are your thoughts on this?
Yeah, I mean, honestly, I can't say I'm surprised by this executive order, but honestly, like designating English as the only official language or revoking that access order, I don't think it's going to fundamentally change the way healthcare is delivered in the United States.
Yeah.
English has been the de facto of English official language for a long time. And just making that official doesn't change the language diversity of the country. It's not like healthcare providers are going to stop providing care to non-English speaking patients just because they can't speak English. Healthcare providers are going to do what it takes, to provide them with, with their needs. Ultimately, politics change every 4 years, probably, even more often. So, our goal right now, our focus is to meet patients and clinicians where they are with the needs that they have today. I would say the one thing I do see this potentially changing, though, is the pace at which healthcare organizations start to look for more affordable options to provide multilingual care. Because I think as the language access mandates are removed, and I think it's a little unclear, how much of that removal is, actually there, but also I think it's not going to be enforced either way. And so I actually think that this actually represents an opportunity for AI to step up and make an impact as healthcare organizations tighten their belts and move away from more expensive options, or at least limit those to where they have the highest need.
Yeah, I think that was the take last week as well. That I mean, executive orders aren't laws. A lot of this is driven by other things than these designations and executive orders. So there's probably in the short term more of we called it a vibe shift in the last podcast. But yeah, another follow up on this, like just the general kind of how do you see the general macro environment, maybe just a little bit beyond even language access and language tech. Like, I mean, there's quite a challenging kind of broader economic environment, but of course AI and AI technology and AI language technology, like the one you're building, is probably about the hottest thing out there generally. So how do you balance these two things? Like you're in an extremely hot space, super competitive, of course, as well, but also kind of these macro headwinds and uncertainties.
Yeah, I mean, I think you're absolutely right. I mean, AI is definitely extremely hot right now, especially AI in healthcare. I think the big challenge that everyone is facing is that it's yet to prove out its ROI to the relevant stakeholders.
Yeah.
And I think there's this rush to prove this out. And I think that's going to play out over the next 2 to 3 years as, people have a little bit more time to see the impact. And for us, that's one of the reasons we're really trying to heavily focus on making sure that we're providing value and measuring that value. Like, for instance, I want to understand time saved in encounters, increases in patient satisfaction, reductions in cost, number of ER visits avoided, and the overall health outcomes. I certainly believe that this patient population is vastly underserved by the healthcare industry due to the limited resources and high degree of friction. And bringing AI into the equation, I think we can dramatically expand the impact of healthcare workers, leading to improved clinical outcomes and increased care. I think a really interesting comparison to this is actually thinking about Uber. When you look at like what Uber did, where in terms of like getting a taxi, it used to be you'd never really know how long you would have to wait until the next taxi was available. You'd stand on the corner in Manhattan and put your arm out and hope it wasn't going to be out for 10 minutes. But with Uber, it's like, oh, I know exactly when this car is going to arrive, and that really kind of changed the way people think about booking and planning, but it also really changed the way people thought about driving and getting around. And you find yourself seeing that, people are renting cars less. You're seeing fewer, drunk driving accidents because people are like, oh, well, I don't need to drive to this. I can take an Uber. That's easy to do. And I think, it really changed the way people think about how they interact with cars and transportation. And I see, sort of this corollary here, with bringing AI into the world. It's like, it's going to transform the way people use this language services in ways that we don't expect. I think we're going to see this explosion in the use of language services in the way we saw this explosion of ride sharing because it's easy and it's available.
I totally agree. I think people have barely wrapped their head around what it means if this is actually going to start working for real, because there have been so many false starts in the past 10 years. And so many apps that kind of promised but didn't deliver. And I think now we're at the cusp of this actually working and us being able, for example, to have an actual call here that's kind of live speech-to-speech translated. Yeah, will be super exciting. So in 2024, last year, you raised a $2.5 million seed round. Like,
Yeah.
any plans to follow up on that? What are your plans there for kind of product like growth versus maybe starting to spend a little bit on marketing and sales?
Yeah, I mean, I would say like right now we're really heads down with a lean and very efficient team of experts, trying to ensure that our early hospital customers are having a great experience and we're learning and improving from those engagements.
Yeah.
See ourselves as like really a first mover in the space with the right team without any legacy or tech product overhead, which means we're able to move quickly and, are already live in hospital systems today. But ultimately, like, I'm a physician and engineer, and so like I think we're always going to be product led, and we're going to be going to build the best product that we can. The early versions that we built are resonating, and we're actually seeing a lot of continued inbound interest, with new executive engagements every week. So I think, leading with the product here for us has been really valuable. And I would say one thing that we've been surprised by is that, everybody in the industry typically knows that healthcare sales cycles take a long time. But that hasn't been our experience to date. We've seen hospitals wanting to move quickly on this and getting it into their hands. And so with that in mind, we're going to continue to focus on those organizations that want to be early adopters and launch as much technology as we can in the short term.
Great. What's on the roadmap for 2025? We probably shouldn't go beyond that.
There are a couple of things. I think, one of the things that we're really focusing on a lot in 2025 is document translation. And because we actually, so we didn't touch on this earlier, but it's,
let's talk about it now.
Yeah, that's it's an area where we're seeing a ton of interest in hospitals. And I think historically, patients are sent home without instructions in their own language. They're not getting personalized instructions. They're getting, formulaic handouts. I mean, at the end of the encounter, they might have someone explain to them what's going on. You have this concept of like a visual interpretation where they'll read and explain it to you. But, at the end, you still don't have anything written in your own language. And the challenge was like, translating a discharge instruction could take anywhere between 30 minutes to a couple hours. And so, it's just not practical to have it done in-house. And it's definitely not practical to have it done, outsourced when you look at turnaround times of days on some of those things. So we've really, we've been focusing a lot on, how can we help facilitate expanding communications in written form, in addition to spoken form? And so after visit summaries is an area where we're seeing a lot of activity. We actually have deployed this now at Children's Hospital of Los Angeles. And it's been really exciting to see that, they've been using this to translate after visit summaries for that. And, because the goal there is really like, at that point of discharge, you can have that information with you to go home so you actually understand it. And we think that'll actually be transformative in terms of both improving adherence to treatment as well as reducing the likelihood of readmission or ER visits for clarity. Similarly, where we're seeing a lot, another avenue where we're seeing a lot of this is with patient portal messaging. The use of patient portals has grown very rapidly over the past few years in the United States, but this community has been left out of that growth. And actually, it was kind of funny. I've talked to a couple of hospitals. They say we're actually encouraging patients to communicate with us in their own language through the patient portal, but we don't have any way of dealing with that. And so they're kind of like they're trying to get users engaged in the hopes that in the future that they'll have a plan for how to do this. And so it's kind of this really weird space. But because like most patient portal deployments, it's like. I would say this patient population doesn't have a way to communicate asynchronously with their care providers. And so being able to bring translation to portal patient messaging means that, I think one of the big things we'll see there is sort of the decrease in the unnecessary utilization of emergency departments, where, it's like you have a question and you have a question, you need it answered. You don't want to have to go in for an office visit. You'd rather not go to the ER. And, you can send the message and, depending on the latency at, the hospital, the turnaround time, you can actually get an answer back in time where it would actually change what your course of action will be.
I was just going to ask about like how challenging it is it to do both, like the speech element and the text element, right? Because like typically in the industry, thinks of this as very separate things, right? Different
Yeah.
companies, different industries, they barely meet. There's the interpreting world and the translation world, right? And they each have their own set of challenges, right? And you're bringing them together under the healthcare and hospital roof, right?
Yeah.
But like generally, like, do you see any major difference in terms of how challenging both are, or you can just see them as both as part of the same problem, essentially?
They share a common foundation. And I think, but they are two very different use cases in terms of like, so like as you build the product, we're really building two different products, an interpreter and a translator, and so that they have a different user experience. They have different ways that we go about testing them and validating them with organizations, and frankly, like even like the form that you're going to use them in, like the interpreter is really designed to be sort of a mobile first encounter where it's like it's running on an iPhone or an iPad. I think iPads are actually where we're going to see the most traction. Whereas for the translator, people are doing it at a desktop, and I think oftentimes the users are different too. Like where on the interpretation side, the users are going to be physicians, nurses, front desk staff, PT, OT, a lot care providers are really going to be. But it's actually at the same time, just people in the hospital where it's like you think about like, well, this is going to really facilitate check-in and scheduling. There are a whole bunch of administrative workflows that we didn't really even talk about that I think are going to really be expanded here as well. And then on the translation side, you're looking at we're actually one of the things that we're actually seeing in terms of the users of that is like one, it's like front desk staff, potentially just translating something at discharge. But an area where we're seeing a lot of excitement is actually use of the translator by the human interpreters. As a way for them to, support the generation of the translation of a summary at the end of the encounter. Because right now, like, an interpreter might, facilitate an engagement, and then they're like, "Oh, could you translate, this note afterwards?" And they're like, "No, I have to run to this other employment, or it's going to take me 2 to 3 hours, and to do that." And so what ends up happening is like a lot of hospitals like either just don't do that, or they have people on the interpretation staff who are like sort of assigned to do translations on a daily basis as part of their shift. But those take a really long time, and so the ability to generate a translation of a document for them, which that they can then scan, review, and sign off on. And this is especially like, for like after a long inpatient discharge, it's like 20 pages of documentation, gives them the ability to do that. That's an area where we've seen a lot of excitement and interest. But you're right. I mean, they are different products. They use a lot of the same technology under the hood. But ultimately, and I think this gets back to like everything in healthcare is like, it's, workflow is what kills technology. And, how do you integrate into the existing work systems? And, it's like the AI itself is not the differentiator in most of these, or in healthcare technology. It's how do you fit into their workflows? How do you make it easy for them to do their jobs? Because honestly, like clinicians hate change. And, changing the workflow is one of the biggest challenges in getting adoption for people. So making it easy, making it fit into their system is really critical.
And I think that's where your background is invaluable, right? Because the traditional kind of language service provider CEO or language tech founder wouldn't understand the nitty gritty, wouldn't understand the workflow. So wouldn't even know what to build for. Right.
Exactly. And this is why it's like, I love working with my co-founder, Julie, that, as a nurse by background, she like nursing kind of runs all the workflow in hospitals, and she deeply understands that and regularly reminds me, she's like, like physicians often have a great experience with this because the nurses all set it up in the background. Yeah. And so it's like, oh yeah, it's like, okay, so really thinking about how do we empower and enable nurses is key. But I think you kind of touched on this interesting point of like, we're certainly seeing a lot of, people pop up in the space, like whether they're Y Combinator startups or like Stanford grads at a hackathon over the weekend, just building something. And it's, and while it's easy to throw something together that does this, like there are a lot of things that you have to do to actually make it work in healthcare. And I would say like, there are a lot of wrong ways to build in healthcare.
Yeah.
And, but, like when you think about it, it's like HIPAA compliance, SOC 2 compliance, those are table stakes. And like, those are things that, you don't just throw on at the end. You have to build from the beginning. And I think that's, having worked in this space, really understanding that there's this need for a secure foundation from the beginning. So thinking about privacy, security, compliance, and trust, as you build from the beginning is critical. So, and I think, the point there being like, we like to think of ourselves as like techie clinicians who like really deeply understand both the workflows as well as the tech, how do you actually build technology for the space?
Great. Well, I think there's a lot more inbound from hospitals coming to you. Seems like you have a very sophisticated vision of what you want to build here. So, Joe, thank you so much for joining the podcast today. This was great.
Thanks. I appreciate being here.